who you're going to talk today. So today we are meeting, this is Atlas Medical Informational Phone Call or Zoom. And any questions I was mentioning to you guys you have, what can we provide for you? We can definitely answer. So I'm going to introduce you to, you already know everyone. So first, let me look, where is Bridget? Bridget is our nurse and clinical coordinator. Here she is. And
hi, Bridget. Hi, everybody.
Hi, Bridget.
Yeah, so I get the pleasure of talking about Atlas today. I think all of you have heard me talk about it, but we just felt like we always want to just continue to educate you all and remind you of our services and help you understand better what Atlas does. But before we get started, it's so great to see everybody's faces. I haven't seen you all without masks, so you all look so wonderful. And I'm excited to just be able to see you today without masks. So anyway, moving forward, so Atlas, what it consists of is we are a primary care that comes to you. So a lot of people call it maybe like a GP, general practitioner. And what's nice about it is we come right to your couch. So you don't have to go to the doctors and wait in the waiting room in fear of getting a cold or, any sort of other virus such as COVID or a flu. So we come straight to you and we bring all the services to you, such as, let's say you do go see your doctor and you need lab work done. Well, we bring that to you. So we do all the lab draws in your living room. And we also, if you were to maybe fall and question maybe your wrist was sore, we can do an x-ray and see if there's any damage done to it. So we can do that right in your home. Or let's say you had maybe some sort of a sore throat. We can check to see if maybe you have some sort of virus there as far as strep goes, or a bacteria, things like that. Or let's say you might think you have a urinary tract infection. We can test your urine in home. So there's a lot of things we're able to do right there in the comfort of your home. And a lot of residents kind of at first say, oh, I've been with my doctor for years and years. And then they switch over and go, wow, this is really so simple, a lot easier. And they can't believe that it doesn't cost any more than just going to your primary care doctor currently. So all you're going to be paying is if there is some sort of copay, you will be paying that. Or sometimes with other insurances, there isn't even a copay, so you don't pay anything. So it just varies between insurances. We take most insurance plans. So I suggest that if you're interested, I can just take a look and we can see if we can cover you as far as that goes. But the nice thing too is we can also help you with any sort of chronic condition. So we will be able to follow with anything having to do with cardiac issues or diabetes. One of the questions I always get from people is, can I continue to see my specialists like neurology or cardiology or maybe a pulmonologist or an endocrinologist? Absolutely, we encourage that for you to see your specialists. Right now, it's a little tricky going out of the building, and so that's the great thing about Atlas coming to you versus having to go out. Then you don't have to be quarantined as well. So that's been kind of a nice thing for a lot of the residents. Some switch over and say, maybe I'll just do this until COVID goes away, which is totally fine. We're happy to help you during that time. So we're pretty flexible, and it's a very simple process when we switch you over to our care. So I think that is about it as far as how it works. We round there. So the nurse practitioner sees patients on Monday. Her name is Leanne Koleski. She's amazing, and she's wonderful at the work she does. She's excellent with gerontology. She has a background in behavioral health as well as working in a pain clinic. So she's excellent at what she does. And I love watching her care for the patients because she really is just so caring and compassionate. So that being said, let's try to think of anything else that we can follow up with. Oh, I know one of the big questions as well is COVID. So a lot of you have experienced COVID tests, and so I do a lot of COVID tests, and I just want to help you understand when we do one, it does take anywhere between 48 hours to maybe 5 days to get results back. So it just varies as far as timing goes. So just wanted to inform you on that. We're just looking into some up and coming, more expedited lab tests and that I'm hearing about that we might be considering doing, which would speed up the process and I think be a lot more helpful for the residents that maybe go to the hospital, have to return and are concerned about the incubation and sitting in your home quarantine for 14 days from just maybe going to the hospital for an hour and coming back. So I will be following up with you all in regards to that. Right now, I don't have all the details, but I'm hearing some information that might expedite the process in the future. So I will pass this on to Kristen now, see if Kristen she can introduce herself, because she is oftentimes rounding with Leanne, and she's wonderful because she can tell you a little bit more about her experiences and how she can help support you. Kristen, you're amazing.
Oh,
she does.
Yes, she is.
yes. Thank you, Bridget. It's good to see everybody's faces, like Bridget said, without the mask. It's kind of nice, and then you guys can see our faces because we're always covered up. I think I know everybody on here. I've at least encountered you at some point, but I, like Bridget said, I do round with Leanne. Leanne's there. They're at Akoya every Monday, and we take the whole day to round there. Just a few things, just to reiterate, we aren't an emergency service. So if there's anything of an emergency nature, we still encourage call 911 or notify the facility, and then they will let us know. But you don't want to call I'm not 911 by any means. So, but if you have any questions or anything, you can always reach me. I think I've given you most everybody my phone number. I have a direct cell phone that you're more than welcome. If you text, you can text me. If you prefer calls, you can call me, but it goes right to me. I'm not on site all the time, but I work at another community. But if there's anything that you need me to come over for, I'm close by, so I can maneuver between buildings. That's no problem at all. I typically am with Leanne on the Monday, so I round with her. So if there's any questions in regards to our visits that we have with you, any follow-up that needs to be done, if you have family that you would like to have contact in regards to your visits that we do, I'm the one that kind of takes that on and kind of takes responsibility for that. So if there's any questions that your family might have that you'd like me to reach out and explain what we're doing, I am more than happy to speak to your family if that's a concern. Other than that, I think Bridget pretty much covered it. I'm here for you guys. We're lucky to be a part of Akoya and to be part of your care team. If you guys are on with us, and if not, we're excited to be there however you need us.
Hi, everybody. I'm probably a new face that you guys are not familiar with, but like Kat said, I'm the administrative director over in the main office. So my roles here in the office make sure that obviously our team within your guys' community is really meeting all the criteria and all the care needs that you guys are needing. Our services with Atlas are very driven to patient care. We are always available at your guys' needs. So during this pandemic, I'm so sorry, the ward quarantine you guys are having to frequently hear, for the fact that the communities just have the realm of keeping you guys all in safety during this time. So if it's not teaching us patience, well, hopefully it's teaching us something, right? Again, our team within the community, we have the office located on the second floor. So again, if the door is not open, we do ask that you do reach our office. We are always available, like I said, for you guys. If Kristen, Bridget, Katerina, the therapy team is not a visual person that you actually see in day of need, we ask that you call the number. So if you guys do have a pen handy, I will be more than happy to let you know the number. So the number is going to be 480-868-9650. I'll repeat that one more time. It's 480-868-9650. When you do call that number, you are going to speak with an individual in the office. So you do have a live person. You will not have to hear a bunch of options to pick, but usually if you do have that option, a lot of our lines, we have about 10 lines here in the office. So at the quickest time that you have, you hit the 0 and you will be directed over to somebody. That somebody's name is Caval. Caval is going to be the lady who normally answers the phone, and you just let her know your name, that you're calling from what community, which is Akoya, and they will be more than happy to transfer over you to your patient care coordinator, which would be Kristen, as well as myself or Riley for backup. So you will always speak with a live person. That's one thing that I do want you guys to feel comfort in knowing, because there's a lot of call systems out there that you guys don't have the ability to talk with a live person. Again, we have our normal office hours of 8 to 5, but we do have an on-call service after 5 o'clock, which does direct you over to our nurse on call. Again, during this time, I just want you guys to know that we are really, Katerina, Bridget, Kristen, Leanne, they have uniformed a way in making sure that you guys have the ability to stay fit, stay healthy, and really know that we're here to support you during this time. So if you guys, again, have ever any questions or needs, please don't hesitate not to reach out to us. My face is more familiar in the office setting, so I do things a little bit behind scene, but I'm involved in every piece of the puzzle to where I guarantee you that if you get in touch with me, I'll get you the right person or help you in any way that I can. So Atlas Medical, we're a mobile provider company. So we actually see patients not only in these assisted living communities, but also in private home settings. We do have about 30 nurse practitioners along with 3 medical doctors who you guys will see the medical doctors. They're more on critical care reviews, which you'll see them about every 90 days. They just make sure that the line of practice is going according to your guys' diagnosis or needs of care. But for the majority of the time, you guys are seeing your physician, which will be Leanne. But as far as us treating in the Valley, we are actually, we just branched out to the West Valley right now. And again, we do have over 30 nurse practitioners serving in these assisted living communities as well as private homes. So in regards to the appointments, I want you guys to know that Kristen and Leanne do a wonderful job in collaborating together, as well as Bridget working with your guys' caregivers within the community. They'll make sure that if you're not seen every week, it's probably going to be every other week, or they're going to be following up with you in any time frame. But if there is ever any need, again, if you don't see Kristen, You can always direct a need to your caregiver and telling your caregiver if they can go ahead and let Atlas Medical or Leanne know that you would like to see them the next appointment.
I was gonna say where you're independent, if you're more than welcome to call me. If for some reason you can't get me as quickly as you need, call the office and they'll know. There's kind of an abundance of how you can get onto an appointment. I'm okay with you calling. I think, like I said, I think most people have my number. You're more than welcome to call me, or if you text, you can text me and say, hey, I need to see Leanne, and we can get you on. Like I said, if you don't get a hold of me quick enough, or you feel like you need to get it urgently, please call the office and say, hey, I really need to see Leanne. And we can get it scheduled. Like I said, I know it seems like we have a ton of numbers, but we just want to make sure that you have multiple places you can go to cover everything. We want you to know that we're here for you and want to make every option available to get a hold of us. But you're more than welcome to call me or text me and say, I need to see Leanne. And my direct line is going to be 480-881-7673.
I wanted to just add one thing. So if there is someone on the call that is not currently one of our Atlas patients, I'm in there quite often in the building, and so many times I'll just come see you and I'll share a little bit more about what we do, help you understand a little better, and then I usually have the paperwork already. It's very easy to fill out, and then we can put you on the schedule for the following Monday. So that's usually how that works. If you would like to be a new patient, I would love to come by and get everything, all your paperwork all ready. It's very easy. I usually just fill it out for you. I make it very simple, and then we'll put you on the schedule for Monday.
For us being mobile, we would function if COVID was happening. This is how we function normally. So any pre-COVID, let's go back to pre-COVID, we had mobile labs come in and take care of our patients anyway.
Yes.
So as far as how we ran things and how we work, nothing's really changed for us. We have several residents that they have PTINR draws weekly, bi-weekly. Leanne manages all of those. So if she takes care of everything. If there's something if the numbers are too high, she manages it. If they're too low, she manages it. So that's kind of a routine thing for Leanne.
Atlas Medical never denies any patient care. That is the wonderful thing. And I know a lot of you it may sound a little bit absurd to know that a primary care physician office would never charge you of any kind, but the gentleman who started up Atlas Medical did it for a reason, and they wanted to make sure, just because of insurance, a lot of insurances out there, nobody would ever be denied care. We never treat anybody different, just in regards to the insurance that they get on. So, however, our recommendations are, there are so many Medicare Advantage plans out there, and they have the right salespeople behind marketing their insurances.
Right.
And I want you to know, just by experience and by working with so many insurances out there, the best thing that individuals in their geriatric ages can choose is going to be sticking with straight Medicare and actually applying for a supplemental insurance, which would cover your 20%. With these Advantage plans, again, they sell you on the plans because they cover some drug coverages as well as dental and vision. And Medicare, obviously, they don't have, those coverages. But when it comes time for falls, in hospital visits, which tend to rise in a certain age group, as well as skilled nursing facilities and rehabilitation needs, those benefits are very limited. So just right now, the recommendations of what we really try individuals to do is if open enrollment is near, we always suggest just sticking with your straight Medicare benefit and then getting a supplemental insurance.
See, and then you guys think about more questions because we have Bridget, Valerie, and Kristen still on the call. And I just want to add to it that you all know me. My name is Katerina, and I try to support you with wellness. Before COVID, I was at Akoya at least 3 days a week. Now we do our virtual classes, which we do usually 4 days a week, which brain fitness become very popular, but we do everything. We do balance, strength, yoga, meditation, everything I'm trying to input into these classes, and just to kind of keep you all motivated, healthy, fit, of keeping you prevented from the falls, because that's what keeps you going. So, but I don't want to take too much of the time. Just to remind you that I always remind you things ahead. We do have another 2 more calls this month. One is on the 19th. We will talk about COVID. We'll have Bridget, Kristen, and we'll have Skip on the phone. And also we will have a presentation about immunization. That will be Bridget, and I will be there as well. And so take these tools and these advantages what we are offering you and use them.
Well, I just to let everybody know, we try to do everything we can with this quarantine. Everything has kind of, it's definitely thrown a curveball in our lives, put a wrench in our daily routine. So we definitely, as a team, Bridget, Katerina, myself, Leanne, Val in the office, we're trying to work together and make things as convenient and easy for you guys. This quarantine thing has really put a kibosh on our daily life.
Imagine an obstacle course. So we are all doing our exercise. We are all jumping and doing our obstacle course every day, right? After COVID's gone, our company, we've been previously before COVID also offering wellness classes at the memory care. So this is wonderful thing, because I would come there, I think three times a week or so, and we would do dancing in the chairs, yoga, meditation, and a little bit of balance and strength. So if, when everything goes back to normal, then that's also, I'm there to support the wellness.
Put a plug in for physical therapy and occupational therapy. Our therapists are back in the building. They're allowed back in there. And they, if you guys are interested in physical therapy, occupational therapy, please reach out to Katerina, Bridget, myself. We're more than happy to initiate that. And that's a service that we can do outpatient therapy inside. So there's Holly, there's Teresa, there's Corey, and there's Mike. I believe a lot of you know Mike. Because he taught a few of the classes there. I think every Thursday before all the fun stuff happened with COVID. So we're more than, like I said, therapists are back in the facility, and they would love to be helpful and of use to you guys. I know with the quarantine, it's kind of it's one of those things that's taken away our muscle strength, and weaknesses has kind of crept up on us. So we would love to have therapy help everyone out. Mike and Teresa, Mike's the physical therapist and Teresa is the physical therapy assistant. Yep, Holly is the occupational therapist and Corey is the occupational therapy assistant. Yeah, we have a great team. We're very lucky with the people we work with. We have a wonderful care team. Everybody's very eager to get people back to their normal function and get them back to strength and routine.
Definitely therapy now is a good time since they are in the building, and it's wonderful. Just even if you need a little bit of help and how to even use the machines or anything of that nature to help you with the exercise routine in the gym.
Yeah, I wanted to tell you that if for some reason you can't remember our phone number or you are wanting to do therapy, you can always go to the front desk, because when I walk in, they tell me all the needs of everybody that is there. So you can always tell the front desk. I think it's excellent just as a clinician, you know, when someone starts to have maybe some balance issues, to not wait until it gets worse to really see our physical therapist, because they can eval you and just see where you're at. Maybe some of the needs, encourage you on different types of moves that you can do some strength training with. But so be sure, if you forget our number, you can always tell the front desk. They always alert me, and then I'll make sure that we set everything all up for you. And make it easy. Okay. And then lastly is, I always say people in motion stay in motion. So make sure that you continue to move. There's so much to your health when it comes to movement. Not only does it help us physically, but it absolutely helps us mentally. And we start to have those endorphins that move through our body, and we start to feel more alert and feel better. It also encourages our white blood cells to circulate through our body, and also increases our immune system. So I encourage you to set a goal, even if it's 3 times a week, to get out and move. And also don't be afraid to just see. We could always eval and see if you would be a good fit to have some physical therapy, occupational therapy.
Thank you guys for being a part of this, and you know, we encourage you to take upon the services that are definitely a benefit in having in your community in the comfort of your own home, to where we're definitely there to serve you guys. Again, we're only a phone call away, only front desk away, and yes, stay healthy, happy, and healthy, everybody. Okay.
I just wanted to add, and I'm the only Zoom call away, so for our wellness classes. So you guys take advantage. And I always say, if you come and if you don't feel doing the whole class, you can stay half an hour. Our classes are about an hour. Try to kind of make you, give you solid exercise. And so if you come for 20 minutes, 30 minutes, that's fine. I don't get upset if you leave. This is for you. It's not for me. And also, if you don't have time to log into those Zoom calls in the morning, you can always log into that YouTube channel, which will be adding more stuff as it goes. But you can always do the exercise whenever you feel like so. But I'd like to say thank you so much for having Bridget and Valerie and Kristen on the call. Kristen, here is Bridget, and here is Valerie. And I'm sure we will have more of these calls. And the next one is on August 19, which we have, we're going to talk about COVID, and August 20, immunization. We also have one more session with the pet therapy with Jolene and her dog Starla too, if you want to join for 20-25 minutes. So that's all in the plan. But